Hi, my name is Dr. Simon Agger, and I'm here to tell you a little bit about how chiropractic works. Sometimes I get asked the question like, why is my pain doing better? Why is my foot numbness gone away? Why are my headaches going away, etc. And one of the bases of chiropractic is that we look at the nervous system. The nervous system controls everything in our body, and all of our joints in our body, they all move. They all have joint play. And joint play is, if you can grab your knuckle and hold your finger, if you can wiggle this back and forth, this is your joint moving. That is normal accessory joint motion, and we need that to do things. We need that to grip. We need it to function properly. And all of our joints throughout our spine, and we've got 24 vertebrae through here, 2 joints, large joints on either side, they all move left, right, forward, back, and side to side. And what happens is we can get joint restrictions. A joint restriction just means that instead of gliding like that, the joint doesn't move in one or more directions. And as a result, the body compensates. Does this give us pain or symptoms straight away? Not always. But as a chiropractor, we're going to look for joint restrictions, whether they're symptomatic or not, because we know that alleviating those is going to improve the function of the body and the way we coordinate and our efficiency and our overall health. So that great feeling you get after you get an adjustment, you feel like not only are you moving better, but also you're feeling like something, you can't quite put your finger on it, but you feel a lot more balanced, and you feel like you're a little more at ease with things. It's because many different things are happening. One of the things I'm going to talk about is how we get joint restrictions in the first place. I like to keep it simple and refer to the 3 T's. And the 3 T's, we're looking at trauma, and that can be a physical trauma, or it can be repetitive trauma, which is very common. The same repetitive task, whether you're sitting at a desk, whether you're bending over, doing repeated manual jobs. Trauma, micro trauma will occur, and we'll get joint restrictions. As the forward head carriage is a great example, where every 4 millimeters the head moves forward from a neutral position where the ear's over the shoulder's over the hip. It doubles the compression on the lower spine. So 4 millimeters is not a lot. It's probably about this far. That's a little more like 5 millimeters actually. So if you can imagine somebody sitting like this, where their forward head carriage is significantly more than that. It does not just double, it triples, quadruples, quintuples the pressure and the stress down through here. So that's a way that people get a lot of joint restrictions in the neck region. Very common. Another common thing is toxins. Now by toxins, it can cover such a wide berth of substances, right? Toxins can be petroleum products, it can be heavy cleaning products, it can be gasoline, it can be adhesives, it can be mold. Anything that stimulates the immune system or the nervous system to have a response. Before the immune system responds, the nervous system has to tell the brain, hey, we got a problem here. We've got some noxious substances coming into the body. And the body's going to have to deal with that. They can cause joint restrictions too. Thoughts. How can they cause joint restrictions? Mental and emotional stress. If you've ever been stressed before, you've been stressed for prolonged times or gone through emotional stuff, it's very stressful in the body. The body will tend to tighten up. It's not going to move as well. You're going to get joint restrictions. And all of these situations, the body's going to try and work its joint restrictions out by moving and stretching. Sometimes it's going to be successful at doing that. You see in youngsters, teenagers especially, they'll pick up a joint restriction, they'll work it out in a matter of minutes or hours. As we get older, we lose the facility to do that, partly because we're not moving around and as active. We've got these 8 to 10 hour blocks of time where we're engaged in certain activities that are very repetitive, and we don't get to run, jump and play like we probably should. So the body can work some of these out when they get a joint restriction. When they can't, we identify the joint and adjust it. Now, how does that make pain go down? Well, in the body, in the spine here, we've got a picture of the spine. In the back of the spine here, that's through all of these joints, through here and through there. We have ligaments that join them. And in the ligaments, we have receptors. And the receptors are those areas that get a message and send it up to the brain. Okay? So these guys here, we have motion receptors. And we're going to draw those in green. Motion receptors in the joint capsule. The joint capsule is the ligament that connects the joints together. Okay, there's a little bit of cartilage in there and synovial fluid. The motion receptors, when we get a joint restriction, will switch off. And we lose a little bit of these guys. So we get less information going up to the brain. Less information going up into the brain when we get a joint restriction. Okay. Now, what if we had a joint restriction for a long time? Well, these stay dormant. Now, the beauty of an adjustment, when we find a restricted joint, we can adjust that joint. It'll stimulate and wake up some of these proprioceptive, that's the big word for a motion receptor, proprioception, well, where you are in space, it wakes these guys up. And we get a bombardment to the brain saying, hey, remember me? I can move this way now. The brain goes, thank God for that. Now I can relax that muscle. Or now I can move that motion segment or that limb or the leg or the glute or the torso a little easier with less resistance. That's exactly what's happening. And when we get pain, if we get a joint restriction, so back to this joint in my knuckle, if this is restricted, it doesn't move like that, it's restricted, I'm still going to try and use my hand. But at some point we're going to get enough compensation, the muscle across here, instead of going like this, is going to go like that and compensate. These other joints may get restricted also. And when it gets to a certain critical mass, my brain will get a message saying, hey, Houston, we have a problem, we need to adjust this, we need to do something. And the pain receptors through here are also in your joint capsules. There's also pain fibers in your discs too. So when these guys get switched on and we start adjusting it, something great happens. When we adjust and we get a very quick stretch on these joints, sometimes there's a pop and a click when we adjust them because there's two joints jammed together, we're all in liquid. That's the sound it makes. What happens is it turns on these motion receptors again. And when we turn these guys on, they inhibit the pain receptors. That's how the pain goes down. So we get a message up here which crosses out the pain too. That's as simple as that. That's how chiropractic takes pain down and gets you moving a little better. Now, last thing I want to talk about is muscle spasms. This is a muscle, as you can see on the board. It's got two ends and a belly in the middle. Sometimes if it gets strained too much, it'll contract and go into spasm. It'll shorten sometimes. Now, when we've got joint restrictions, some of these muscles get inhibited because the nerves that come out between the spine, they work these muscles. These guys, these nerves, go out into the muscle and make them contract or relax. Now, if we've got inflammation around the joint, this doesn't work as well, and we're more likely to get compensations. So as a result, we can get tight muscles. And if we get tight muscles through here and we have joint restrictions in the neck, we adjust the neck, the muscles release. Normalizes the function, okay? So we can have muscle tightness, and the muscle tightness and spasm, and that can be a result of joint restriction. Very commonly it is. When we have muscle spasm, it's usually a protective mechanism to try and protect the joint. The joint's been injured and the muscle is trying to spasm across it. So as we calm down the joint, get the joint moving again, decrease the pain, the muscle will normalize too. Okay. Finally, last thing I'm going to talk about is cartilage. We've got a picture of a disc, one of these intervertebral discs there between each vertebrae through here. They tend to wear in certain areas. We'll take an x-ray, we'll look at pictures and we'll see good, 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 not good. And the reason for that is because cartilage has a blood supply only to the outer third of the cartilage. So the question is, how do you get nutrients in to the inner 2/3 of the cartilage, and how do you get the waste products out? Okay, very simple. It's motion. You've got to keep things moving. So when we have a joint restrictions that's been there for a while, very commonly you'll see a decrease in the disc height around that area. Very commonly you'll see it on injuries. After someone's had an old injury, you'll see a couple of joints in the neck or the low back or the mid back even, where that joint has been restricted as a result of the injury. For whatever reason it hasn't been addressed, or it was addressed, it got non-symptomatic, but the joint restriction maintained after repetition of a certain job or activity, because we all do the same things over and over again. A lot of times we have habits. So one way to keep that moving is to keep you moving. So that's why range of motion exercises, anything that you can move the body and do, is very, very important. That's why having your spine checked on a regular basis is also very important to maintain these goals. And if we've got repetitive trauma, if we've got toxins we're exposed to on a regular basis, or you've got big stressful areas in your life that reoccur or don't occur much and then come on, get checked. It'll help not only your cartilage, not only your muscles, and your overall efficiency. I hope that explains a little bit on the guts of how the nervous system works when you deliver a chiropractic adjustment, and how you get a joint restriction, what to do about it. Again, my name's Dr. Simon Agger, and I look forward to seeing you in the clinic. Feel free to look at our testimonials on the website. Thank you.